what are the FDA new regulation for breast implants and what are these guidelines mandated by the FDA?
In 2022, the FDA came out with new packaging guidelines for breast implants, as well as a patient decision checklist, which has been mandated by the FDA for discussion and signature by both patient and plastic surgeon prior to breast implantation.
There are some terms like black box warning, and why don't we start with that? What is a black box warning and how is this affecting actually both a plastic surgeon and their patients?
Anytime the FDA has specific wording about risks of a device and they put it on the packaging, it's literally printed within a black box.
Yeah.
That doesn't mean that a patient sees it. The doctors are supposed to know that there are specific considerations or warnings or risks, and the black box means there's emphasis by the FDA. In 2022, I remember I had to sign a document that I was aware of it and that I was going to abide by those concerns. But then I also had to sign documents that I believe all plastic surgeons had to sign, that if they're ever going to use a breast implant, that they would discuss the risks and benefits and alternatives in a patient decision checklist. And this was the result of collaboration between plastic surgeons and patient advocacy groups and the FDA to improve awareness and education and make informed consent a better process for all.
I remember when I did my breast augmentation around 2009 or 10, the discussion with my plastic surgeon was mostly about the aesthetic part of the procedure, whether it's under the muscle, on top of the muscle, whether you're using a different shape of breast implants. But now with the rise of breast implant illness and patient advocates like myself and also doctor like yourself, Dr. Randall Feingold, that are raising awareness, now the discussion is actually shifting towards what is safe, what are the regulation, how to monitor these breast implants, and so on. So maybe we can talk a little bit more about why patients today are still not informed by plastic surgeons, and also what is the decision checklist that this doctor are supposed to go over with their patients.
I can't tell you that patients aren't being informed, because I know many plastic surgeons that give fair and accurate information. Obviously, patients have the right and perhaps some responsibility for doing some research before they undergo procedures, but there are responsibilities that every plastic surgeon must divulge the proper information. The patient decision checklist is several pages long.
That's the point.
And requires a conversation by the plastic surgeon. And it goes through all types of health concerns about who is a good candidate for putting a breast implant in, what are the types of things that would make someone a poor candidate for a breast implant, risks of breast implant surgery in terms of the actual surgical complications, the risks of breast implant associated ALCL from textured implants, the risk of systemic symptoms that one could get after breast augmentation, specific risks such as leakage and rupture, capsular contracture, rippling, the follow-up monitoring of breast implants with imaging studies, the opportunity to have questions answered, different options, whether you're having a mastectomy or whether you're having a breast augmentation. The patient is supposed to initial all these different categories as the list is reviewed, and then the patient and the physician both sign that conversation took place. So it's really very well thought out and very detailed, and there is a process in place now to better educate plastic surgeons as to the reasons behind this, the reasonableness of doing this, the fact that the FDA requires it, and that our Plastic Surgery Society expects plastic surgeons to abide by it.
What are actually the FDA screening recommendations for breast implants?
The recommendation for silicone implants is that after 3 years to get a imaging study, such as a high resolution ultrasound or MRI, every 5 years or so thereafter. I'm sure there are plastic surgeons that do good follow-up with their patients and check for these milestones and keep surveillance, but there may be many patients that either don't follow up with their plastic surgeon, or if a plastic surgeon doesn't follow up with their patient, that these patients are lost to follow-up and not getting specific screening. I suppose if someone's over 40 and getting mammogram, sonogram on a regular basis for breast cancer detection, there's an ultrasound component that will help screen the implants. But if you're in the 22 to 39-year age range and not yet doing breast cancer surveillance, then theoretically no imaging is going to be done.
Yeah.
The plastic surgeon arranges follow-up at intervals of certain years so that it doesn't get lost.
So when it comes to breast implant longevity, does the doctor inform the patient about when they should replace it or exchange it?
First of all, doctors should tell patients that these are not lifetime devices.
Yes.
I've had many patients tell me that they thought they were lifetime devices, or that their plastic surgeon told them they'd be good for life and said goodbye to them after, we really don't know what the lifespan of breast implants are. There are no implanted body parts that are forever devices. It wouldn't matter whether it's a valve in your heart, a pacemaker, a shunt in your brain, an artificial hip joint, a knee joint, shoulder joints. Man-made parts have lifespans. I think when I was early in practice, I would tell patients it's probably good for 10 or 15 years, but I don't know where that number came from. And then over the years, many patients came to me and said, I have an implant that's 10 years old. I'm here to change it. And I would say to them, why would you do that if it's intact and it's soft and you're comfortable? It's not quite like that. But now I rethought this because I've explanted many patients with ruptured implants that are only, say, 7 years old. They haven't even reached a 10-year milestone. So I think the right answer to patients is they're not lifetime devices. They may last for decades, if you're fortunate, but what you really need to do is periodic surveillance. And if it's not broke, I guess you don't have to fix it. But the only way you'll know is by doing imaging studies.
I want to ask you about the fifth generation breast implants, because I've seen some plastic surgeons who are advertising that they are so much better than fourth generation, which is the older breast implants. And it sounds like this one is a device for a lifetime. It's durable. It doesn't leak or bleed any silicone. So what's your experience with this? And maybe it's good if we just explain what is the fifth generation breast implant.
There are several new products on the marketplace. The buzz about cohesive gel, that's not new anymore. That's many years old. And the textured implants really aren't used anymore, at least in this country. The newer products go to different surfaces of implant shells, just gel formulations. I don't have personal experience to tell you where this is going because I don't think anybody, certainly not in this country, has long-term experience because many new products are tested outside the United States. There's data generated, then there are studies done within the United States to corroborate what's learned from out of the country. And then at some point, the FDA approves them. So it would not be correct to tell a patient that any implanted medical device is a guaranteed lifetime device, but I couldn't speak to what longevity really is for the latest generation of devices because they haven't been out there long enough. Certainly not 10 or 15 or 20 years use.
How does it change when a woman comes after breast cancer and she wants to do breast reconstruction as opposed to a woman who comes for aesthetic reasons?
Patients that require a mastectomy for breast cancer or gene mutation, something is being imposed upon them. They're forced to take action. They're doing an operation that nobody really wants to do. Most patients undergoing breast reconstruction want to preserve breast form for the obvious reasons of femininity and sensuality and motherliness. And there are options, and creating a breast mound, whether it's out of an implant or natural tissue, are the broad categories of options. And it really depends upon their body type and whether they have donor material within their body to create a new breast mound without using an implant, or whether they're willing to have an operation to transplant body fat, whether it's from their abdomen or thigh or buttock, to create a new breast mound without an implant. It also depends on their community, who the plastic surgeons are, what their training and experience is, and what their comfort level is with those types of microsurgical operations. Those patients are definitely feeling the pressure to do something, and if they don't have any body fat, for them, the choice may be implant or nothing, and nothing may not be a viable option for them. For the women who want to augment a breast, I think just like in breast reconstruction, there's been a trend toward more natural tissue over the years. We're seeing that also in breast augmentation. I'm very comfortable with fat transfer in the forms of fat grafting that comes from liposuction harvested fat. Women who seek breast augmentation need to consider their goals. They need to research the options, need to have some flexibility of thinking to know that there may be a natural tissue solution and not necessarily assume the implant is the only choice or the right choice. And you'd be surprised how many women out there, when educated about the ability to use their own fat to augment their breast, whether because they have a small breast or they've breastfed, had pregnancies and lost breast volume,
Yeah.
are happier with the choice of using body fat over an implant. Regardless of why you are in a position to consider breast surgery, you just need to do some research, and you need to know that there are options and be open-minded about those options.
So I want to go back to the FDA guidelines, because they actually were created because of the rise of the breast implant illness awareness, and also many patient advocates that brought it forth on the social platform. Is this actually changing the entire conversation around breast implant illness as well? And women are treated more seriously now?
Well, I think that the guidelines, as you said, the patient advocacy groups were concerned about systemic symptoms, breast implant illness, but
Yeah.
also because of capsular contractures, and also because of ruptures, and also because of the uncommon malignancies of implant capsules, such as anaplastic large cell lymphoma or squamous cell carcinoma of the implant capsule. So there was a lot of reasons why there was a buzz amongst patient advocacy groups and conversations with the FDA. When
Yeah.
it comes to breast implant illness or systemic symptoms from breast implants, I've become aware, because of that patient population, just how many women out there have been impacted by breast implants. And that's increased my sensitivity in terms of listening to patients.
Yeah.
I think there are many plastic surgeons now that are paying attention and recognizing and treating patients based on their history, knowing that they don't have other defined illnesses to account for their symptoms. Initially, I think there was a misconception amongst plastic surgeons that the patients were being misled because of social media conversations, but I think we've moved away from that now. There are many more plastic surgeons that are listening to their patients and giving them credibility and trying to help them.
And I think we are both seeing quite more plastic surgeons jumping into the platforms and talking about breast implant illness, explanting, and so on. It used to be mostly patient advocates or testimonial from women. Now we are seeing both sides embracing the idea that breast implant illness is something real, and that indeed some women, not all of them, do respond negatively to having a foreign device in their body.
All you have to look at is the number of studies, both within the United States and internationally, to look into symptoms, inflammatory pathways, biofilm, the interaction between bacteria and fungus and mold, human body, to validate that many plastic surgeons are taking this seriously now.
Looking ahead, if you could send one message directly to your colleagues across the US, actually, about the importance of being transparent with patient safety, what would it be?
We're plastic surgeons, but we're doctors first. We're not supposed to harm people by the things that we do. We have to have some humility and listen when patients tell us that something's wrong, because nobody knows your body better than you do, whether you're a doctor or not a doctor. You just have a sense, that something's wrong. And so we have to give our patients credibility. And the truth is, all of us are always learning from our patients, and we just have to be open-minded and be good doctors in the process of being good plastic surgeons.
Actually, this episode is aiming to talk to both plastic surgeon and to their patients. And I'm hoping that as we are wrapping up today's conversation, that I can send a message. As a former patient, I would like to see more plastic surgeons taking their time and helping women actually go through this checklist, which is, like you said, is so long. And I know from my experience that many times you just sign in your initials and you go on, you don't even read it. So I'm hoping to see more plastic surgeons take it seriously and actually inform women and about the risks also. And on the other side, we have the patient. And I want to say, because I can see a lot of women in our Facebook group that they are very confused, they're very hesitant. And I would like to empower them to really listen to their intuition. Like you said, nobody knows your body like you do. And also go to a practitioner that really listen to them and make them feel like what they're going through is real. And I think that this is really important to based on that, to make what's called informed decision.
Those of us that are involved in patient safety matters are developing tools for both plastic surgeons and patients to get comfortable with and understand the patient decision checklist, at least for those plastic surgeons that put breast implants in. But I know from talking with many colleagues that there's a change from skepticism to better understanding and acceptance about our patients' symptoms and their concerns. So things are getting better. It never happens overnight, but there's a collaboration between physicians and patients and the FDA.
If a plastic surgeon does not go over the checklist and black box warning, are there any implications legally to that?
First off, the vendors that manufacture breast implants are not supposed to ship implants to providers who do not use these checklists. Is making efforts to educate them. I do think there would be repercussions in terms of being in good standing if you're not going to follow FDA guidelines. I personally wouldn't want to be found guilty of violating FDA standards, whether it's a regulatory or legal outcome. So I'm not aware of processes against physicians for not adhering to these guidelines per se, like on a case-by-case basis. But I have to believe no plastic surgeon wants to take those risks.
Where do you see 5 years forward or even 10 years forward, breast reconstruction? Where is it going?
Breast implants were the first tool that existed more than 50 years ago. Eventually, that led to natural tissue techniques, flaps, like a tram flap from the abdomen, which required damaging muscles Then that led to microsurgical free flaps, which allowed creating breast mounds out of pure fat without sacrificing muscles. Then that evolved to using fat with nerve grafts being hooked up to improve sensation of the newly created breast mound. Then came fat grafting using fat harvested with liposuction to improve results of implant and flap reconstruction, although there are some patients that will choose flat closures and then maybe build up small breast mounds just with fat grafting. But probably the next evolution would be tissue engineering, where
Oh,
we could stimulate the development of
yeah.
natural tissue without necessarily having donor sites that require incisions. I can't tell you the status of that today, but in my mind, I would see that as the next evolution where we could instruct the body how to repair itself without interventions that are as invasive as what we are doing now. Well, I think stem cells definitely have special powers that we haven't fully
Yeah.
discovered yet. And there are many applications in medicine of stem cell therapy and with growth factors. But there are many people brighter than me who do bench research in laboratories working on these right now. And I have to believe that the next chapter in medicine, will be using the body's own ability to heal to help us with many diseases, even when we have to remove tissue from the body. It may be that the best form of breast reconstruction will be prevention of breast cancer and removing the necessity for removing breast tissue. There are many considerations out there about how women decades down the road won't have to endure mastectomies, or how we can create better outcomes for patients with less invasive approaches than we have to use today.
This is fascinating as always. I want to thank you again for taking your time and raising awareness, educating our patient and also plastic surgeons in the US about FDA new guidelines, and we are hoping that everybody will be safe and healthy.
My pleasure, Liara. Thank you for doing good work.